Hello, everyone, and welcome to our Monday Minute. Today, we're going to hit the highlights of the home health final rule for 2023 that was released October 31st. This final rule brings with it many of the changes that were proposed in the proposed rule finalized just as they were proposed. However, extreme disappointment in the fact that the behavioral adjustment that was originally proposed at 7.8% reduction in our permanent 30-day base rate. They have decided to split that in half and are going to take 3.9% this year and the 3.9% in any future needed adjustments at a later time. Because of the fact that they did increase the market basket from the 2.9% that was proposed to now 4.1% with a productivity reduction of 0.1%. So basically 4% is the market basket adjustment. It did cause the rates to go down, but they will be instead of the $2,031.64 base rate that we have today, the base rate next year will be $2,010.69. That is up dramatically from what was proposed at $1,900 and some odd dollars. But the reality is it's still 3.9% less than it should be. There is still activity going on in Congress. With the two bills that have been introduced, one at the Senate and one at the House, trying to get those passed so that home health would see no reductions in payment through the year 2026. If that were to still take place, there should be room for making the change so that this 3.9% adjustment could not actually take effect in January. Obviously, it could be retroactively corrected if the legislation does not pass before January. So as of right now, the base rate will be $2,010.69. All of the LUPA per visit rates are not in any way impacted by the behavioral adjustment. So they received a 4% market basket increase. So there is quite a bit of an increase in each of the per visit rates. In addition to the rates, they did finalize that home health agencies will be required to complete and submit OASIS on all patients regardless of payer, but they will not make that effective until 2025, first affecting our home health quality reporting program outcomes in 2027. They also finalized that there will be 3 new G codes to report the different levels of telehealth and remote patient monitoring on your claims. It will not impact your payment. It is for information collection only. This will become voluntary in January and be voluntary through the end of June, and then will be required to be implemented in July of 2023. So any telehealth or remote patient monitoring that you provide to the patient will need to be reflected on the claim, even though it will not impact your payments at this point. It will simply provide additional information to hopefully set future rates for us to be reimbursed for telehealth. In addition to the changes we've already discussed, the case mix weights for each of the 432 HIPS codes have been revised yet again and finalized as they were proposed. They have also finalized the changes in the LUPA thresholds exactly the way the changes in the LUPA threshold were proposed. And lastly, the value-based purchasing model that is set to begin nationwide January of 2023. There is or was a proposal to change the baseline year, which affects the calculation of payment, to 2022. It was originally finalized in the 2022 rule to be 2019. So basically that means that achievement thresholds and benchmarks that will be used in the calculation of the 2023 outcomes will not be available until July of 2023. So that will give the system time to get all of the 2022 data in the system, calculated, analyzed, etc. And then they will issue the achievement thresholds and benchmarks based on the 2022 data. Not the news that I had hoped to be able to bring you today, especially in regard to the rates with this final rule, but we will continue to fight the fight and continue to work with our legislators to hopefully get these rates dealt with and fix it so that home health will not see a reduction in rates through the year 2026. If your state or national home care association contacts you to help support that legislative fight, please make sure to participate and contact your legislators and let them know how deeply we need this to be changed. Thank you all for participating today. Have a great week, and we hope to see you at a live conference soon.